oldest son, who's 32, came in to see me. He walked in and said, "Oh my gosh, Mom, you look like I remember you at 35. And I said, "Oh my gosh, thank you, Dr. Halpern." I was very pleased. Yeah.
Did you feel like a different person?
I did. I've always been rather shy and always looked down a lot. But once I had my face done, it's like a whole different air of confidence came out, and you can walk into a room like you own it, and you have eye contact, and you greet people in a different way, and it's a wonderful feeling.
Okay.
It's a wonderful feeling.
Well, thank you. Thanks for sharing your story with us, Allie. We appreciate it.
Thank you.
Allie is obviously very comfortable being public with what she had done. And plastic surgery has lost a lot of its stigma. The picture you showed us of the little girl who had her nose altered, 30 years ago she would have gone away to summer camp and come back, or we all know the women now go away to vacation and come back refreshed. This is changing. People are being more open.
That's correct. Before, people kept it a secret. Now people are they share their thoughts either online or with each other, and they're not ashamed at all of having the surgery.
Why do you think that is?
I think it's become a lot more accepted after those reality shows like The Swan or the Makeover, and where the American public can see how it affected everyday Americans. It's not just for the celebrities and the rich and famous, but the impact that the American public has seen on TV has revealed that it really makes a big difference in their everyday lives.
So obviously the media and celebrity culture have helped the plastic surgery acceptance.
Correct.
But we do have a few cases that really raise eyebrows. The MTV reality star Heidi Montag, The Hills, she had 10 procedures done in one day, and then she was on the cover of every magazine, I think. What do you think about that? 10 procedures in one day?
Well, number one, you want to keep everything safe. This is elective surgery. You don't have to have everything at one time. And in addition, it's important, for me, I like to try and keep things more in the norm, not over-exaggerating the human body.
And so we'll go back to Heidi as an example. She had her breasts increased to where she says she can't hug anyone or jog comfortably anymore, and I think her lips are out to here. People are doing that for what reason, do you think?
Well, in the beginning, when people have the surgeries performed, and like her first procedure that was performed, she got beautiful results. They looked very natural. They fit her very nicely. And then there's a small segment of patients who want to take it to the extreme. And for those people, you have to sit down and counsel them, because as we say, the enemy of good is perfection. And if she got a really good result the first time around, to operate on her again and give her a very exaggerated result where she doesn't look normal, for most people, they don't like that. That doesn't look normal for them.
So whose role is that to say to the would-be patient, no, that's too much, you should not have that done?
Oh, I've told that a number of times to certain patients. I said, you've had enough surgery for now. Enjoy life.
But clearly that's not happening across the board. We think of cases like Joan Rivers, Michael Jackson. There's a woman who made herself, she looks like a cat. She's had so much plastic surgery. That's not happening everywhere.
Well, it's up to the individual, plastic surgeon, but my opinion, my attitude is I want to do what's good by the patient. And if I think that they're taking it a little overboard, I tell them that, in my opinion, they've had enough, and to enjoy life rather than to go and have additional surgery.
And plastic surgery is always evolving. You mentioned now the endoscopic surgery.
That's correct.
Is that most common now?
Well, to the level that I perform it at, most surgeons don't take it to that level, but a lot of surgeons do perform the endoscopic surgery. There's a learning curve, so when it's not a type of surgery that you go to a weekend course. You really need to do kind of like a mini fellowship, or where you spend some time with a surgeon. But that has really revolutionized the way I do facial surgery, because now patients can go back to work easily within a week.
But it's fair to say that the trend is, of course, to less and less invasive, as
That
much
is
as you can
correct.
make that happen. And then new techniques like fat stem cell therapy?
That's correct. The fat cells that are taken from one part of the body and injected to another part of the body, for example, into the cheek area. As we get older, we lose the fat in the cheek area and gives us a more aged look. Or a lot of women will say after a facelift, what gives their age away is their hands, and you can inject it into their hands. Not only does the fat make those areas look younger, but there are stem cells in those fat that actually transform the skin and make them look younger. And now various researchers in the United States are using these stem cells to see if they can get them to develop into certain types of organs.
Now, when we talk about the fat stem cell plastic procedure, though, are we taking the patient's own fat?
That's the beauty about it. You take the patient's own fat, and usually it's from an area where they don't want it, and then you put it in the area that they do want it. And you can do basically anywhere on the body, and since that is your fat, then you don't reject it.
So here's a gentleman who, what did he want fixed on his face?
Well, this is a 46-year-old gentleman, and he complained